today is with me, Dr. Kamal Ramchandani. As we all know, today is National Vaccination Day. So let's plunge into the information about COVID-19 vaccinations as we all have many questions about it. Dr. Kamal Ramchandani is MD in Homeopathy, professional counselor, health coach and medical yoga therapist since last 15 years. And she is also dealing with mind and body therapies like Bach flower therapy and emotional freedom therapies and many more. She also has done many camps about bone marrow density camps and weight loss camps. Let's hear it from her.
Hello everyone. Basically, my mission on this earth is to enrich the holistic health of each and every individual. It is like you have important not only to the physical health but also the mental health, the social health and the spiritual health. So that is why the aim and ambition is to enhance and enrich this holistic health. And also, one more thing to go on is currently we are working on preventive health, and that is why as today is National Vaccination Day and a lot of patients calling out for different questions. So let's see what kind of questions do you want to address. Yes, welcome.
Yeah. So the first question is why should we take the COVID-19 vaccination?
Yes, a very important question. Why should we take COVID-19 vaccination? The answer of this why is very important. Number one, this actually the disease of COVID-19, it is infectious as you all know. So as to prevent the infection in the population, we need to take vaccination, because if it is individualized, it will just affect a person. But here we all want to save the nation, we want to save the world. That is why to prevent the infection in the community, the first reason is vaccination, and second reason is to reduce the morbidity. That means the rate of deaths of the people, those who are suffering from COVID-19. And third reason is, well, if you have to travel either nationwide, state-wise or abroad, you need to have vaccinated so that you don't spread the infection worldwide. Yeah,
thank you. The second question was कि ये COVID-19 vaccination काम करती है तो कितने हद तक काम करती है?
Very important question. ये वैक्सीन क्या काम करती है? See, वैक्सीनेशन का मेन एम क्या है? हमारी इम्यूनिटी कोविड-19 के अगेंस्ट डेवलप करना. एंड इसका रोल कैसा है? करंटली जो वैक्सीन्स अवेलेबल है जैसे कोवैक्सीन, कोविशील्ड, कोविन, इन सब वैक्सीनेशंस का यही है कि फर्स्ट डोज अगर आपने लिया है तो सेकेंड डोज यू हैव टू टेक आफ्टर अ मंथ, एंड आफ्टर द सेकेंड डोज then after 15 days only you develop the immunity. And it is not sure, the fact is like you develop a immunity but it is not giving the assurity that you may not suffer from COVID-19. आपने वैक्सीन लिया है पर इसका मतलब ये नहीं है कि फिर से आपको इन्फेक्शन नहीं हो सकता. आपकी इम्यूनिटी डेवलप हो सकती है, हो सकता है माइल्डर इन्फेक्शन हो सकता है ना भी हो सकता है हो भी. बट इट इज़ इम्पॉर्टेंट कि हाँ, ये वैक्सीनेशन लेने से जनरल पॉपुलेशन में जो डर है आज, डर जिसने ज़्यादा मौतें की है एक्चुअली कोविड-19 से भी ज़्यादा, the fear has taken the toll. So it is better that the community comes out of the fear by any way. Maybe this is vaccination is one of the way wherein whole population may develop a herd immunity and kick out the fear and develop the immunity in the process coming years. Yeah.
So next question was कि आपने अभी types बताए vaccine के, तो which vaccine is safe and which should we take?
See, all three vaccines are safe and we can go in for any of the vaccine which is available currently.
Okay, and who all can take this vaccine like now?
हाँ, according to government protocols, the current protocols अभी के लिए 60 age and above they can walk in for vaccination without any kind of certification from the medical practitioner. मतलब उनको कोई सर्टिफिकेट लेने की ज़रूरत नहीं है, they can directly walk in for vaccination. But the people जो लोग above 45 हैं उनको डॉक्टर से एक सर्टिफिकेट लेकर आना है. If they are suffering from any other illness like diabetes, like BP, like some other any disease, they just want a certification from the doctor that he or she is fit for vaccination. That is a process, and each and every individual has to carry their Aadhaar card so that they get notified in the community, and then they can go on further whether they want to travel or whether they want to be on the safer side for any other activities.
Okay. And ये जिनको कैंसर है और else has asthma or has any other heart problems, so can they take COVID-19 vaccination?
यस, सी कैंसर पेशेंट्स की इम्यूनिटी पहले ही कम होती है, और जो किडनी पेशेंट्स हैं, डायलिसिस पे हैं, डायबिटीज़ वाले हैं, हार्ट पेशेंट्स हैं, स्पेशली एस्थमा पेशेंट्स हैं, इन सब के लिए ये वैक्सीन सेफ़ है। और ये वैक्सीन कौन नहीं ले सकता है इज़ कि जिनको बहुत सीवियर एडवर्स रिएक्शंस हो चुके हैं पास्ट में कोई और वैक्सीन से, या फिर किसी एक दवाई से हो चुके हैं उनको एडवर्स रिएक्शंस, या जो लोग बहुत ही एलर्जिक हैं, लाइक बहुत ही सेंसिटिव लोग हैं, उनके लिए इट इज़ नॉट एडवाइजेबल दैट दे शुड टेक दिस वैक्सीन। Secondly, the children below age 16, still the vaccination order has not come for the people below 16 years of age. Maybe in the coming months we get the order. And thirdly, pregnant ladies, of course, they can't take currently this vaccination. So these are the few criteria wherein strictly the vaccine is contraindicated.
Okay. And what are the side effects of vaccine, like after taking the vaccination?
Yeah, side effects जो वैक्सीन्स के हैं वो बहुत कॉमन साइड इफ़ेक्ट्स है, जैसे फीवर आना, फर्स्ट सेकेंड डे पे फीवर आना, बहुत वीकनेस होना, या कभी कभी शिवरिंग होना, या फिर नोशिया वॉमिटिंग सेंसेशन होना, या फिर गिडीनेस होना, या फिर स्वेटिंग होना। दीज आर वेरी कॉमन साइड इफ़ेक्ट्स।
Okay, so what should we do to prepare ourselves for the vaccine?
Yeah, so initially don't go empty stomach. खाली पेट तो वैक्सीन लेना नहीं है। You have to fill your stomach and hydrate yourself with water. Carry dry snacks with you, and whenever you are getting vaccinated, be prepared that even if you get fever for a day or two, you take Crocin tablet and take rest at home. Okay?
Okay. And बहुत लोग ऐसे बोलते हैं कि my immunity is very strong and I take all the precautions. So is it necessary that they should also take the vaccine?
See, it's not necessary because ultimately your immunity matters. But if your immunity is good and if you take the vaccination, it is obviously at the positive end, but it is not necessary per se. But if we have to prevent overall, because this is an infectious disease, so we have to prevent overall India, overall worldwide, then it is better that we should take vaccination. And one more fact, like even if you take vaccine, you will be skipped off COVID-19. It is not like that. And once you have taken vaccine, you might be the carrier for other person. You might not get infected, but you can be the potential source. आप दूसरों को इन्फेक्ट कर सकते हो, दो अगर आपने वैक्सीन लिया है और आपको इन्फेक्शन नहीं हुआ है तो भी आप दूसरों को इन्फेक्ट कर सकते हो जिनकी इम्यूनिटी कम है। सो दैट इज़ वाई इट इज़ इम्पॉर्टेंट कि इवन इफ आपने वैक्सीनेशन ली है तो भी आप सोशल डिस्टेंस मेंटेन करें, मास्क पहने, और जो प्रिकॉशंस, जनरल प्रिकॉशंस हैं, वो डू कैरी फॉरवर्ड ऑल दोज प्रिकॉशंस।
ओके, सो मतलब हमें ये सारे प्रिकॉशंस फॉलो करने हैं। तो मेनी पीपल आस्क लाइक कि 100% रिजल्ट्स कैसे आएंगे?
हाँ, इट इज़ ऑल डिपेंडिंग अपॉन आवर इम्यूनिटी बेसिकली। एंड ये वैक्सीन जो है इट इज़ फॉर कंसिडर्ड लाइक आफ्टर 2 doses, एंड आफ्टर 2 doses के बाद भी 15 days के बाद यू गेट immunity, and that also immunity it is not defined कि ये इतने समय तक रहेगी. It can be from 6 months to a year or so. It can be till 9 months also. The expectant period of time is not that research proven, but yes, some limitation of the time is there, and maybe the virus mutates next year and you might have to get introduced with a newer vaccination because the virus has already mutated. Okay, the newer variants of the virus has come, so this vaccination might not work in the next year.
Okay, so we'll have to take the vaccine in the next year also?
Yes, you might have to take it if your immunity is not so good. So better is always work on your immunity. And how you're going to work? One is your nutritional status, one is your exercise, and one is your proper medication. Okay, all these 3 things are very important for your immunity. Okay, and whenever you are in a movement or exercise, your immunity boosts up. Whenever you take a healthy diet, your each and every cell gets energized. So that is why it's equally important that we don't only depend on vaccination, but we ourselves develop our immunity in such a manner that whether we are vaccinated or not, we are able to fight any kind of infectious disease. Yeah.
Okay, thank you so much, Dr. Kamal Ramchandani. It was really informative. And we surely build our immunity so that we can fight this coronavirus vaccination, and we will also take COVID-19 vaccine.
Yeah, to sign off, it is very important that each and every individual individual develops their own immunity and not depend on vaccination. And also take care of yourself, and if you have any queries, any questions, do put up on the questionnaire list or do call up. Yeah, thank you.